Do you have difficulty getting your elbow to that 90-degree hook position? Is your coach constantly yelling at you to lift your elbow up higher, but for some reason you're stuck at a 45-degree hook? It's very frustrating when your coach keeps yelling at you to lift your elbow up higher and higher while you're practicing your combinations. When in your mind, you're thinking, it's up. How much higher should it go? And that's when you catch yourself in the mirror and you see that your elbow is way down here and you thought it was up here, which can be pretty alarming. And once you get over the disbelief that your arm isn't where you thought it was, you could be worried that something serious is going on in your shoulder. But the good news is you're not alone. Many martial artists and boxers deal with this exact same thing. And second, it's completely fixable. So first, let's talk about what could be affecting your hook angle, and then we'll discuss strategies to improve that hook angle and ultimately the power of your hook. Okay, so two things that could be affecting your hook angle are your posture and your rotator cuff. If your posture is the issue, you very likely don't have shoulder pain. You simply can't get your elbow to the specific height you want to. It just stops. You don't notice the limited range since your body is telling you that your arm is where you want it to be. But occasionally, people will have pain with this, but that's only when they try to really force their arm up higher than it wants to go. So first, we'll talk about how posture affects how high your arm goes. So with martial arts or boxing, you have to protect your torso from getting hit. So it is common to practice punching from a protective stance, a stance that is typically rounded and slightly elevates your shoulders. And this allows you to protect your face and your body. Over time, many martial artists tend to adopt that more rounded forward head posture, even when they're not competing. And again, this is great for your sport, but it is not best for your shoulder. Over time, forcing your shoulders forward pulls your arm bone up and forward inside that joint. When the joint space above your arm bone is lessened, you lose range of motion, since that space is what allows your arm to rotate. So let me show you what I mean. If I take the protective stance, my shoulders raise up, come forward, and then if I do this, I only have that much range. But if I do this, I have way more range of motion. So I'll show that again. So if I'm here, I can only raise my arm up so high, but if I'm down and back and up, my arm goes real high without any pain. Can you see the difference? So now let's talk about how an injured rotator cuff affects your elbow. If your rotator cuff is injured either through an impingement, which is pinching, or even a small tear, you'll have pain getting that elbow up to 90 degrees. So you'll have pain almost throughout the whole range, at least not the majority of it. But as we were just talking about, your posture is vital for your shoulder health. So if you're constantly staying in this rounded forward head posture, you will change how that shoulder has to work, because like I showed you, you lose range of motion. Again, that rounded position pulls your arm bone forward and up inside that joint. Normal joint space created by having your shoulders going out more, so like sideways more versus here, and your head over your shoulders, and then your shoulders over your hips, which are over your knees, which are over your ankles. So the joint space created by this posture helps your rotator cuff pull the arm bone down slightly, allowing it to rotate up, and then your deltoids take over to get your arm over your head without it running into the acromion, which is this top of your shoulder right here. Without a rotator cuff, we would not be able to raise our arms above shoulder height, because the joint space would just run out and you would just sort of stop because there's no rotation allowed. So back to the hook position. Over time, this posture causes that loss of range of motion, and the rotator starts to get pinched until it tears. Over time, that pinching will just wear down the tissue. So to be fair, this progression is for everyone, not just martial artists. However, when you use your arm for more than just typing and drinking coffee, you have a little less room for error. So the good news is that posture and that painful rotator cuff can be corrected and resolved. You can resolve the pain of that rotator cuff and the difficulty of getting your arm into that hook position. So to address the posture, it's a matter of working on the muscles that pull your upper back into extension. So basically it's the muscles that oppose your pectoralis major and minor, because they're pulling you forward. So you have to work on things that pull you back. So that would be your mid and lower traps, your rhomboids. So then you have to follow that up by practicing to be upright. So once you get the muscles there, you have to kind of get where this feels more normal, where your upright feels normal. So if you want a quick check on your posture, I have a trick for you. So if you lean back against a wall, get down kind of into a semi wall sit position, you're going to have your back flat against the wall with your feet slightly in front of you, and you try to get the back of your head against the wall with your nose pointing forward. And so you'll realize real quick how tight anything in your upper back is, or how tight in the back of your neck. So that's something to try. So now I want to give you 5 ways to help your rotator cuff. So number 1 way to help your rotator cuff is to ice it for 10 minutes. Now, punching is a shoulder dominant workout. Just like any other part of the body, after a strenuous workout, it's common to have a little swelling. And so by using ice on your shoulder, you can help to bring that swelling down a lot more quickly and improve the recovery time. So that'll help you prevent being overworked or overstrained. Now, I know it's difficult to ice your shoulder. It doesn't stay in one place. So I have a trick. If you can use a pillowcase to wrap it around and hold that. I have a video. Or you can go on any number of sites and order an ice pack that's specifically for your shoulder, which allows you to kind of move around and do everyday things. So the number 2 things you can do is to stretch. And I know that stretching is not fun because it doesn't seem like there's an immediate benefit, but it is so crucial for your arm to stretch it out. The more the muscles are stretched, the more pliable they are, which allows them to adapt to physical stressors. And after your workout, find time to stretch your upper back and your pecs. Again, they're what's pulling you forward. So number 3 to do, upper back strengthening. So it's common for us to go and get used to the same workout all the time. So most people do lats and rows for their back day at the gym. Those are great, but it is also important to throw in exercises for mid and lower traps and your posterior delt, because again, they're the ones that pull you back. So an example for that would be to do pull aparts, but you got to prevent your shoulders from going up. So those pull aparts. 4, rotator cuff exercising. Nothing is going to help you, the stability of your shoulder, more than rotator cuff exercises. Working on internal rotation and external rotation is key to saving energy and giving you more power when you punch, because now the deltoid and your pec don't have to waste all of their energy stabilizing your shoulder, because your rotator cuff is going to be doing its job, and their job is to produce a lot of power. So as you're progressing the strength of your deltoids and your pecs and your back muscles, you also need to make sure that you're intentionally strengthening your rotator cuff. So those internal and external rotators. And number 5, see a professional. This will save you so much time, anxiety, frustration that comes from the uncertainty of trying new exercises, changing your exercise routine. And I get a lot of very common questions. So here are some of the questions that I get when I first start working with people. How long should the discomfort last? What pain is okay to push through? And how long do I need to try these new exercises before seeing results? Can you imagine doing that on your own? So it's exhausting. All right, so there is no reason to try to take on this task all by yourself. It's very overwhelming. As a general rule of thumb, pain with movement or a movement dysfunction that lasts longer than 2 weeks is not going to go away on its own. And the faster you get to help, the less likely there'll be lasting damage. So the faster you see somebody, the less likely there'll be damage. If you've tried some or all of these suggestions and you're still not back to 100%, a professional can help cut through all the trial and error and find the root cause of your specific issue and give you a personalized program to fast track your results. So, excuse me, if this is the type of care you're looking for in Cypress, Texas area, and you're ready to get started, call us now or click the button below for the cost and availability. You'll fill out a quick form and we'll call you back to answer any questions you may have and to get you on the schedule. So if you're unsure that this type of care is what you're looking for, perhaps you're skeptical that we're any different than the last person that you worked with, or simply you just have questions about your specific needs, please click the button below that sets up for talk to a therapist or talk to a PT. We will get you on the schedule for a 20-minute talk with me. And during that conversation, you can ask me any questions about your concerns and or your specific situation and needs to make sure that we're a good fit before you ever commit to coming in. So I hope that this information is helpful,